Doctor, for baldness, is it true that I have to take lifelong treatment? Doctor, I went to another doctor. He said, you have to take treatment forever without any stopping. I got discouraged and I stopped the treatment. These are the things which patients tell us. I have seen many patients, young people, 35, 36, they have come in stage 7, complete baldness. Why did you take treatment? Sir, I went to a doctor. He said you have to take treatment lifelong. I got discouraged. Who will take treatment for lifelong? So I stopped it. So now let us look at this question. Is it true that everybody has to take lifelong treatment for baldness? To answer this, I am Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Bangalore. To understand this question and answer this question, we have to look at different parts. What is the cause? What is the process? What is the progress? What are the other factors affecting it? And most importantly, what is the requirement of the patient socially, psychologically, professionally, etc. Now, as we all know, male pattern hair loss or pattern baldness is genetic. It occurs only in men. There is an inherent genetic weakness in the roots which makes them weak and they fall off. This much is true. But the process by which this leads to baldness is very, very variable. One, it does not happen in the same way in everybody. It takes different patterns. That is why this is called pattern hair loss. You can see here all the stages of baldness, how they happen. Somebody may progress quickly, somebody may progress slowly, some people may not progress at all. Somebody may become bald here, he may not lose any hair here. Somebody may become bald at the vertex, he may not lose any hair in the front. In such people, once grafting is done for the front or the bald, whichever is the bald area, remaining hairs, if they are stable, medicine may not be needed for a long time. In the another category of patients, they progress for some time and then they stop. Then after 5 years or 6 years, they may start losing hair again. So that is intermittent progression. In such patients, treatment may be stopped in between only to pick it up later. Third, in many patients, their requirement is age specific. 20 to 30 to 35, maximum 40. At a time when they are about to marry, they are searching for a career and a profession, they are very much bothered about it. Once that requirement is taken care, they are no longer bothered. They themselves say, sir, my requirement is done, I am satisfied, I don't want to take medicine. That's perfectly fine. We are not trying to save life here. And finally, everybody has to understand that the hairs are not weak to the same extent. Some hairs are strong, some hairs may be weak. So the proportion of this varies from patient to patient. Other factors will affect it. Smoking, metabolic syndrome, obesity, diabetes, stress, lack of exercise. If these things are taken care, diet, if that is taken care, the need for medicines becomes very less. So, when you approach this problem in a holistic way, it is possible to control many patients with drugs when needed. So, what we do is we give the drugs for 2-3 years, assess the patient and then take a decision. There are many patients who have stopped treatment after 5-6 years. Many of them have retained hair forever. Some of them have come back after 10 or 15 years to say that they are losing hair and we restart the treatment. So it is extremely variable. So nobody should think that I have to take medicine for 50 years and so I will not start it all. That's a very, very negative approach. Also remember, whatever we are telling you now depends on the knowledge available in medical science today. And what is that? We have drugs such as finasteride and minoxidil. We have biologic regenerative treatments such as platelet-rich plasma. We have physical energy devices like laser. These are the approaches. But there are many new treatments which may be coming. It's a genetic disease. So, genetic alterations are possible. We may be able to test which treatment works best for which patient. For example, minoxidil testing is already available. Likewise, cloning may become available. It is possible to test the hair, take out the strongest hair, store them in laboratory like you store an ovum, then clone the hairs and inject it. This may happen maybe in 10 years or 20 years. So, why am I saying all these things? It is wrong to assume a negative attitude that we have to take it for life. That is not true for everybody, for various reasons I have already explained. Many patients can be controlled with intermittent therapy, proper diet, platelet-rich plasma, healthy lifestyle, and we can see them through the second, third, fourth decades along with transplantation. Only in small number of patients, 20 to 30%, the progression is relentless and they need continuous treatment. And that is not a big number. So, in summary, this is what I want to tell. Do not have a negative attitude. Do not take a pessimistic view. Be positive. Consult your doctor. They will choose the right treatment for you, along with the advice how to take it. It is possible to control you in a very safe manner by a holistic combinational approach. You can see this paper here, combinational approach. And along with transplantation, it is possible to see most of the patients through the most crucial part of their life, vital part of their life, between 20 and 40 without any hassle. I hope you have liked this video. Please visit our website venkatcenter.com. Share this video. Please give your suggestions. Thank you very much.